Bismillahirrahmanirrahim. In this video, we are going to discuss efficacy. It is defined as the maximum effect of a drug that can be achieved regardless of dose, or it is the greatest effect an agonist can produce if dose is taken to very high levels. In therapeutics, efficacy is a parameter which denotes extent or degree of an effect that can be achieved in the intact patient. It can be measured only by graded dose response curve. An agonist, when combined with the receptor, produces a response, and as the dose is increased, response also is increased, till a maximum effect is produced. At this point, the response remains the same even when the dose is increased, and the maximum response is called efficacy of drug, and it is denoted by Emax. It is determined by characteristic of the receptor-effector system involved, drug modes of interaction with receptor, and affinity of receptor for drug. As you can see in the graph, between the drug concentration and drug effect, Emax is shown. Clinical significance is that efficacy of a drug is crucial for making the clinical decisions when a large response is desired. For practical purposes, efficacy of a drug for achieving a therapeutic endpoint, for example, increased cardiac contractility, may be limited by the toxic effect, for example, fatal cardiac arrhythmia, caused by the drug at higher doses. Partial agonist has lower efficacy than full agonist. Pharmacological antagonist has zero efficacy, and inverse agonist has negative efficacy. That was all from the topic of efficacy.